Good afternoon, everyone. As at 3 p.m. this afternoon, Tuesday, April 14th, the WHO would have announced that some 1,844,863 confirmed cases of COVID-19 existed among the member states, and that there was a total of 117,021 deaths. The Federation of St. Kitts and Nevis would have received the results of 12 tests that would have been sent to CARPHA, the Caribbean Public Health Agency, and those samples would have been sent off on the 13th, which is yesterday. These are from 12 persons of contacts who had already been placed in quarantine when their contacts received the confirmation of their test results. The results were received today in very quick time, and of the 12 tests, 10 were negative and 2 were positive. These persons who tested positive were already in quarantine and will remain in isolation as per our protocol that has been in place from the very beginning. These 2 cases reside on St. Kitts, and of these 2 cases, one was a close contact of a positive case and was already in quarantine, as stated earlier. The second, however, is a family member of a suspected case already in quarantine. And these 2 cases, of course, represent local spread of the virus within that household. Let me repeat that sentence. These 2 positive cases represent local spread of the virus within that household. It doesn't say within our community, within that household. We continue with our vigorous contact tracing and quarantine and isolation procedures in order to keep the virus under control, and we continue to stress the importance of personal responsibility in our efforts to control the disease. We are thankful, however, that to date, all of our positive cases are doing well and recovering, and that we have had no hospital admissions or deaths with regards to COVID-19. To date, some 234 persons have been tested, and of course, with the 14 positive results that have been mentioned. And if I could go a little further and now do an updated breakdown or distribution of the 14 cases, 10 of these cases are in St. Kitts and 4 are on Nevis. A total of 187 confirmed negatives have been received, and we have some 33 results that are still pending. There are 29 persons quarantined in a government facility, while 111 are quarantined at home. 14 persons remain in isolation, and obviously these are the 14 cases that have tested positive. And to date, some 552 persons would have been released from quarantine. It is the Ministry of Health strategy to achieve a positive outcome as it relates to COVID-19, and that is to reduce the intensity of the outbreak and to slow down the increase in the number of cases as far as possible. To accomplish this, as I would have stated earlier, we are engaged in early detection of the cases through isolation and appropriate management where necessary, and also through aggressive contact tracing and the quarantine of the contacts of the cases. The ultimate goal of this strategy is therefore to interrupt transmission of the virus throughout the St. Kitts and Nevis population. Before I close, I wish to remind all of us that we each have a responsible role to play in controlling the spread of COVID-19, and we also have a role to play in protecting ourselves from COVID-19 as well as others around us. We encourage you to continue to engage in the social distancing measures that are currently in place, to eat well, to get adequate rest, to boost your immune system, to engage in effective hand washing practices, and finally to wear masks when out in public. We would have had quite a detailed discussion on this topic by Dr. Wilkinson, our medical chief of staff, several days ago. We are reminding persons, please, as far as possible, wear a mask. A cloth mask with closely woven fabric is sufficient for outdoor use. Please reserve the surgical mask for medical professionals as well as the N95 mask because they are in short supply and we need to protect our frontline medical workers. By adhering to all these practices, I am positive that we will have an excellent outcome as far as possible as we continue on the journey towards eradicating and fighting against the invisible and deadly virus called COVID-19.